There are days where I can't get dressed because I'm in too much pain. My day-to-day life is really hard.
Feroza's life is governed by a mountain of medication, continuous pain and continuous waiting.
I've waited for rheumatologists to see me. I should have been seen every 8 months, and I haven't been seen in 2 years.
Feroza has multiple conditions. Treatment for all of them is delayed. She's just one of 7.5 million people in England now on a waiting list for hospital treatment, the highest number since records began. Today's headline figure is bad, but when you unpick the numbers and drill down, the details are more worrying, say health experts, because these delays are not minor. In more than 380,000 cases, patients were waiting more than a year to start their treatment. Only 59% of people started their treatment within 62 days of an urgent referral from a GP. To put that another way, if right now 100 people went to see their GP and their GP said, I am referring you urgently for treatment, 2 months from now, 41 of them would still be sat at home worrying, waiting for their treatment to start. Are there people right now dying because of delays in their treatment?
Absolutely.
Some delays cause prolonged pain. Some cause shortened lives. For cancer patients, immediacy matters.
Today's numbers are an absolute disaster.
Are you surprised by them?
No, not at all. This has been getting worse and worse and worse. Over the years, we've been shouting about it. No big surprise. But for patients, this is an absolute disaster. 4 in 10 people with cancer are not getting their treatment on time. And we know that for every 4 weeks delay in treatment, you can have an up to 10% increase in death rate. Thousands of patients are going to die unnecessarily unless we get this right, and there is no signs that it's going to get right at all.
And I want to start with our biggest public service emergency, the massive backlogs in the NHS.
That was Rishi Sunak's pitch this time last year running for the Tory leadership, doubled down on at the beginning of the year.
NHS waiting lists will fall.
Instead, the numbers have gone up. A bad situation made worse by continued strike action. In June, junior doctors in England walked out for 3 days.
Industrial action is an important factor, but we also know there are some long-standing challenges there, and COVID as well, which really accelerated the impact of these challenges. So it's not just about strikes, but they are an important factor.
NHS strikes are only going to make the situation worse, and that's why I think it is unforgivable that the Prime Minister has been missing in action throughout these strikes, failing to negotiate with NHS staff.
NHS England say today's data is a reminder of the significant pressure on staff, with this summer on course to be the busiest in NHS history, all while industrial action continues to disrupt services.
So this is my hospital letter to say my appointment.
For Feroza and millions more, the wait continues.
I physically struggle from one day to the next, and I'm only 45. I don't know long term how much worse I'm going to get. And without the support that I need, I can't see how my life can improve.
Feroza now has an appointment to see a specialist. It's in October.
Paul McNamara. Well, I'm joined now by Mike Greenhalgh, who's in Chorley. He's Deputy Chair of the BMA Junior Doctors Committee. Will be on strike tomorrow from his job as a trauma and orthopaedic surgery registrar. Thanks for joining us. Let's be clear, the waiting list isn't 7.5 million because of strikes, but you are making it worse, aren't you?
So I think you said yourself at the start of the programme, Christian, there's several factors leading into this waiting list, and the number one thing to look at is the time it's been over. The waiting list has been going up and up and up for years, and that's because of a chronic underfunding and understaffing of the NHS. Even before COVID, we had the best part of 5 million on waiting lists, and before we took our first round of industrial action, there was already 7 million. So whilst some appointments will be delayed because of the action we're unfortunately been forced to by the government, it certainly isn't the biggest factor at play here.
No, but people might be suspicious that there is politics at play here as well, and that Rishi Sunak has pledged to bring them down, and your strike effectively can make sure that he can't meet his pledge. You know, so that might actually hide some of the deeper problems that you've just highlighted?
So the BMA has been consistent with its messaging throughout this dispute, and that was before Mr Sunak stood behind a podium and made his pledge about waiting lists. NHS leaders and the BMA have been pointing to the rising waiting lists for years, and so whilst we, I don't think that we've had any change in our messaging at all in response to that, so I don't think we're playing politics. If anyone's playing politics, I'd point the finger straight back at the government.
The sheer numbers are extraordinary, though, aren't they? I mean, there were about 2.5 million in 2010, and you know, they're now at 7.5. So, I mean, do you have, beyond sort of the broad brush of sort of underinvestment and not doing enough, are there specific reasons why it's gone up so much that you would know what to target if you wanted to try and bring them down?
So I think the jewel in the NHS's crown is its staff, and the way that you get these waiting lists down is by investing in the staff. You can't get waiting lists down without doctors, and that's why we're calling on the government to work with us rather than against us, to make us a credible offer to reverse our pay cuts and get us back to work, helping get waiting lists down, getting people seen by their GPs sooner, getting operations done much sooner than they are. In my own practice, we're having to tell people that they're going to have to wait 12, 18 months for an operation that they are in severe pain for, and it's awful to have to do as a doctor, but we're not going to be able to get the waiting list down without the staff, not just doctors, nurses, everyone in the NHS. As I say, there's been a chronic underfunding and understaffing, and that is the underlying problem here.
But are you saying it's got nothing to do with the way the NHS is run or is organised? You know, that it is simply about not having the staff, or is it actually about the way the staff work, the hours that you work, the weekend working, the evening working, all that kind of stuff? You know, that there might be ways to bring this down and make it more efficient. Do you have a sense of what they might be?
I'm sure there are. I'm sure there are. I'm sure there are people looking at that. In certain places, operating lists are still going on weekend days to try and help get the waiting list down. Junior doctors are there working every weekend and working into the evenings at nights as well to do their bits for that as well. But in terms of sort of broader, larger reorganisations, this sort of thing gets tried every few years in the NHS, and unfortunately, despite that, the waiting list has continued to rise.
I mean, we can see from the messaging today that's come from NHS England that they are going to point more and more at the junior doctors' strike. So when you come up against patients who wonder whether you're the reason they're waiting longer, what's your answer?
So, firstly, I'd like to apologise to anyone who has had an appointment or an operation postponed because of strike action. However, I'm sure that those people themselves and everyone else on the waiting list will appreciate the fact that when they've been first put on that list, these waits are too long and ridiculously long for anyone in the first place, and it's because of these underlying factors that I mentioned that they're having to wait this long in the first place. So to these people, I would say that we're sorry it's taken so long to treat them in the first place. We're sorry if there's been any further delays. We're working as hard as we can to try and get these waiting lists down, but we need more of us. We're stretched very thin. We need more staff, and to keep the staff that we've got, to retain them, we need a fair pay deal. Otherwise, more and more are going to leave to other careers and other countries and other healthcare systems.
Dr. Greenhalgh, thank you very much.